when I had my first seizures, when my family and I called it a seizure disorder. Now we call it what it is, epilepsy. The diagnosis, classification, and treatment options are all important to managing epilepsy, according to the journal article entitled Seizure Classification Key to Epilepsy Management, found in the practitioner page 13 through 19, written by Drs. Louise Davidson and Chris Derry. The correct diagnosis by neurologist or epilepsy specialist is the key to rule out other things that might mimic epilepsy. The bad thing, of course, is that the person having the seizure does not know what is going on. So the diagnosis comes from the information given by people who witness it, from EEGs, MRIs, or CTs. Diagnosis typically comes after several seizures, not just one. Next, the doctor has to classify the type of seizure, and this depends on where the seizure starts in the brain. First, there's generalized. This seizure involves both hemispheres of the brain. People like me, when generalized seizures, experience shaking of the arms, legs, and body, brief jerks, or even brief staring spells. A person can have all or just some of these. All of these things can be triggered by sleep deprivation, alcohol, or photosensitivity, just to name a few. Secondly, there is focal. These seizures start in one area of the brain. Most people with this type have awareness or partial awareness during a seizure. Doctors want to know if something has happened to cause it, like a brain injury, or if it's genetic, or in most cases like mine, there is no known cause. Finally, there is the management of the seizure, which is, like the article said, ultimate goal for anyone with epilepsy. People with epilepsy want the freedom to be able to live a normal life without a bunch of side effects. There are several choices for control of seizures, with the most common being medication. The doctors want to be very careful in the diagnosis in order to choose the anti-epileptic drug that best fits the person's type of seizure. It might take more than one type of medication. In some cases, surgery is an option. This article stresses that epilepsy can be a challenge for doctors and patients. First, with the diagnosis and classifying seizures, and then choosing right type of medicines. My life has been greatly affected by seizures, such as driving privileges taken away after a seizure. Making sure I take my medications every day and obeying my doctor's rules will help me live as normal life as possible.